Are you ready for it? All right, everybody, let's shake it off. What other Taylor Swift pun can I come up with?
Dude,
because
I'm
you
lost.
are never, ever going to hear another podcast episode like this. I know all too well that our listeners are ready to be enchanted by another podcast guest. Welcome back to MB2 Underground. I'm Sarah Kiefer.
And I'm JT. Sarah, that's an impressive... You continually surprise me with your ability to come up with those on the spot, and I know zero about Taylor Swift.
Me either.
But that was pretty awesome.
Thank you. Did you introduce yourself?
I did. I said I was JT.
Oh, great.
And Jonathan Tyrock for the new listeners that we have, the new undergrounders on YouTube and Spotify and Apple Podcasts.
Well, I know we're just going to have a lot of people coming in to this episode, dropping in specifically because of our guest today.
Yep, she's awesome.
Go.
Should I just go ahead and introduce her?
Yeah.
We're bringing on Dr. Colleen Mohn, who is a partner of MB2 since 2018. 19?
16.
Well, yeah.
Yeah.
Well, hang on. We'll get to that. Dr. Mohn, welcome.
Thank you.
Thank you for coming.
And I really appreciate the Taylor Swift acknowledgement.
I'm not a Swiftie, so it took a little bit of digging, but anything for our guests.
My assistant will appreciate that because whenever she puts Spotify on for me to listen to while we're working on a patient, I ask for Taylor Swift and then it totally ruins her algorithm.
Oh, yeah.
So when did you start liking Taylor Swift? Was this like back in the day when she was, singing about I don't even remember what that first song was.
Yeah, high school. That first album, that was a country album.
Yes.
Which is funny because she's not even country.
Oh my gosh, I remember that. That's when I listened to her.
Yes, exactly. So that started, and I've been to 4 concerts.
Whoa.
Oh my gosh.
Yeah.
That's love.
Yeah, I know. My husband brought me front row to the Reputation tour when we were dating. So I think he was trying to lock it down.
Yeah, you're like easiest yes ever. Just keep doing that.
Exactly. But then he refused to go to the Eras tour with me, so I went with friends from dental school.
Damn straight you did.
That's cool.
Yeah.
I heard it was pretty awesome.
It was amazing.
How many times did you go to the Eras tour? Did you just go to one show?
Oh, just one show,
Okay.
Yeah. But it was like an all-day event. We did like VIP tickets, so we were there in the morning, and then you have like Taylor cocktails, and then they have like a pre-show with DJs playing more Taylor Swift music.
Cool.
Yeah, but you guys would probably hate it because you're listening to
I
Taylor
feel
Swift
like-
for like 24 hours.
I feel like I love the vibe. Like I would
a
be
good
able
vibe.
to like vibe out.
Yeah. And my daughter has a little shirt. It says, in my 1-year-old era. So it's just represented everywhere, annoyingly, but also cutely.
I love that.
Yeah.
Maybe that's what we're celebrating.
Celebrating? Well, I mean, we can absolutely celebrate that.
Should we?
There's so much to
Cheers.
celebrate.
Yeah.
Yes.
Well, since we're celebrating and it's in the morning and we have some orange juice.
And it's me.
Woohoo!
Welcome back
Thank
to MB2, Dr. Mohn. While we pour
the food.
these mimosas, tell us, correct us, since Sarah and I and you all disagree.
Yeah.
2016, 2018, 2019, MB2.
Okay.
Colleen Mohn, how did you get here? How did you find MB2?
So MB2 Associate 2016. So I graduated from Midwestern University in Arizona, and I was looking for opportunities in Texas specifically. Love the pouring in the background.
Oh
It's
yeah.
perfect.
Wait, why Texas?
So I had a lot of friends who were in dental school who were from the Texas area, and they were just saying a lot of really good things about it. Phoenix in particular was pretty saturated.
Yeah.
And there were certain areas of Texas that were still growing. So it was really important to me. I wanted to go somewhere where was needed and could learn a lot.
Yeah.
Do, a lot of dentistry right out of school to be successful. And so I was connected through Dental Town with Dr. McBride. I saw an ad about West Texas, and so I applied to that. And I flew out to Midland, and Sarah, you've been there. When you're flying over into Midland, Texas, it was at nighttime, and you see these flares coming up. You see all the little pump jacks, all the oil rigs. It was just such an interesting environment.
And you see I have never seen such beautiful sunsets in my life.
There's nothing obscuring it.
No,
it's just
it is
flat and
insane.
gorgeous. You were just showing me a picture that you'd taken there.
From back in the day,
Yeah.
yes.
Yeah, so you really appreciate the beauty of the area just because you can see the sky. There's nothing, obscuring it. So really, really beautiful place, but dry. Like if you imagine Texas and tumbleweeds, that's what it is.
The stereotypical Texas.
Stereotypical, like usually once a week we have a tumbleweed that is like stuck by our house, by our entryway. So it's pretty awesome. But so I get to Midland after graduating, an interview with Dr. McBride.
Yeah, I heard you had an interesting interview story with him.
I did.
I would love to hear.
Yes. And this is probably what contributed to me selecting the job. I was just so impressed.
Love it.
Yeah. So he takes me to his office. At the time, he owned like 5 Bliss offices. And so he introduces me to his wife, Dr. Ann, who was practicing at the Bliss office in Midland. And so he's like, hey, like you're going to be shadowing, Dr. Ann for about an hour or so. And then, after that, I'll take you around to a few other offices just so you can, see and meet the other associates and everything. So I'm like, oh, perfect. So I'm shadowing Dr. Ann. She's doing her thing. She is just amazing, just pulling out teeth left and right, really. Like she's just like so efficient and such an amazing dentist. Well, we realize come like 5-6 hours later, she's like, do you know where Dr. McBride went? Where's my husband? And I'm like, I have no idea where he went. He just disappeared. So finally he reappears and he's like, okay, let's go to lunch. And by this point, it's like 2 or 3 p.m. because I started there in the morning. And so we go to lunch and he's not eating anything. And so I'm like, you're not hungry? Like, what's going on?
And there's nothing worse than like sitting down to eat with somebody and they're like, oh, I won't have anything. Thank you.
Yeah, exactly. So it's just me eating and he's just staring at me. And so it's kind of like that scene from Bridesmaids where the person has like food poisoning and you're like, you're not hungry? Like you don't want to eat a Jordan almond? And they're like trying to eat that. Do you remember that scene?
Yep.
He had food poisoning and he had been spending all day at his house by the bathroom.
Oh, no.
Yeah. And it was very endearing to me. I think I was just like, I would love him to be my boss. Like,
Yeah.
this is so
This
great.
guy that's sitting here going, I'm sorry I bailed today.
I know, but
I had to go potty.
yeah. So we talk about it all the time, but it actually was like a big blessing in disguise because I got to shadow the office and I was like, this is where I need to be. Like, this is where I'm going to learn. I'm going to see so many patients, great patients, like just very down-to-earth, humble community. You could have somebody that walks in your office wearing jeans and a tech vest that's like a billionaire because they're just such humble oil, executives and oil people. And it's a really great family town. So
I'm about 10 years late, but let's cheers to that.
Oh, yeah.
To 2016.
cheers. Yay.
So if I picked up anything from that story that we could share with the listeners or to recap, if you need to sell an associate on your office, get food poisoning. That's the takeaway?
That's what it is.
That's what
A
endeared
recruiting
you.
tool.
Yep.
Yes.
Oh, that's great.
So you're working, and I mean, you're having to adjust to a very different life, right? So you're like out of dental school in Arizona, and I guess it's dry there too, but West Texas is a very unique community, like you mentioned. And I guess at some point you decided this is where I'm going to set down roots because you became an owner early 2019.
Yes, and that's where that MB2 partnership comes in. So I kind of consider myself a partner, since 2016 because I bought in really quickly.
You drank the Kool-Aid
I
really
drank
early
the
on.
Kool-Aid. Yes, I did. And so that's why, I champion it so much because I don't think I would have progressed from being an associate to an owner so, seamlessly if it wouldn't have been for MB2.
And your integration director.
And exactly, yes, my love integration director.
Wait.
Yeah,
Who was your integration director?
Not to toot my own horn.
You can toot it. It was Sarah, and she actually. So you did the first video of a transition, right?
Yeah. So for our listeners, and by that I mean JT, that may not know, back in the day, Dr. V wanted to do doctor interviews during integration week, and I was so new. And so I had to do like a whole Instagram takeover for the first one. And then Dr. Mohn's buyout was my second ever integration. So I'm worried about how do I interact with human beings?
Oh my gosh.
How do I log into the check scanner? But I'm also having to do this interview and I had never met Dr. Mohn. So I'm sitting there like, oh, I hope she's normal because I don't know what I'm doing. And she sat down, she was like, okay, so I don't know what I'm doing. And I'm like, yes. So this is a very full circle moment for us to be interviewing her.
And that's cool.
Yeah.
Do you remember like what it was that pushed you over the edge saying, I want to stay here and be an owner here? Was it opportunity? Was it your now husband or?
I think that played a big role,
Yeah.
honestly. So I moved to Midland in August of 2016, and I met my husband, Chris, in September.
Whoa.
Yeah,
August. So you met him in Midland.
in Midland.
How did you meet?
So Bumble.
Bumble.
I love it.
It's so romantic, you know, like this story will go down in history as being the most romantic gesture. But I liked it because it was like I could do my research on him, you know, make sure he didn't have any mugshots out there on the internet.
Important.
Yes, but Bumble is, I don't know if you're familiar, but the app is female driven. So I liked it. I'd never done anything like this, but I was moving to a new place. I didn't know anybody and I wasn't about to just go out by myself and try to meet someone. So on the app, it has a female CEO, and the woman actually is the one that initiates the conversation if you match. So you're not going to have some random guy just like sliding into your messages and like saying unsolicited things.
Yep. Interesting.
JP may not fully appreciate that, but I do. We had a conversation with another podcast guest where they were like, oh, you really worry about men on the internet trying to kill you. And I was like, yeah, as a woman, you kind of
Very
have
real
to.
thing.
Yes.
Definitely.
And especially in a whole new place where you don't know even, I mean, at that point, you weren't integrated into the community yet. So you didn't really know what you were stepping into.
Exactly. And so he was the only person I had met up from that, fortunately. So it worked out the first time.
That's awesome.
I saw that he was Canadian. And at the time, I had some friends who were dating Canadians. And so I was like, okay, I'm going to give him a shot.
I love it.
Come on.
He's probably pretty nice. So we met up for dinner and the rest is history. So that did play a big role because he was also a transplant to the area. Works in sales, you know, within the oil industry, and he had worked his way up. He was up there in Calgary, Alberta, you know, up there north working on the rigs. Like started out as like a hand up there in like negative 40 degrees.
Oh, no.
Yeah. So right out of like high school, that's what he did. And then he got his degree and then he kind of worked his way up into the oil business and ended up now, you know, he's in a really amazing spot running like the whole region for his company. Cool. Yeah. So we connected on that too, because we'd both come to Midland for our jobs.
Yeah.
And so that was a big factor. But then also too, the mentorship I got from Dr. McBride and Dr. Ann in the practice as an associate prepared me really well to go into ownership. And then also having MB2 as a partner to mitigate risk, you know, financially, you come out of dental school with quite a bit of debt. So it could be really, really taxing to go in and, you know, buy a practice from a private practitioner. Also, can you find, you know, a private practitioner that would be willing to sell to a newer grad? So MB2 helped with that integration process for me and supported me. I wanted to really just focus on the dentistry. That's what I love to do. I love patients, team interactions, and all of that. But when you're, you know, a young dentist, you don't know what you don't know.
Mm-hmm. Yeah.
So having a partner like MB2 to come in and support me in the business end of running a practice and also helping me successfully take over a practice from a retiring doctor.
That's what I was going to say. Like in the role that I'm in now, helping associates become owners is a lot of my job. And there's a lot of ways that happens. But your route was unique in which you are an associate and your first experience becoming an owner is buying out a retiring dentist at a practice you were not involved in.
At all.
So this was a practice that joined MB2 and our associate doctor out there bought in at that point. What was that experience like for you?
So it was amazing because I think there's always that concern, like, is the staff going to stay? Like, this was a very, you know, long tenured team.
Oh, yeah.
I still have the office manager.
She's still there.
Melanie.
Makes me so
She's
happy.
still there.
That's crazy.
Yeah, she'd been with him for 25 years. So we just celebrated her 25th anniversary.
Oh,
And
that's
then
amazing.
the hygienist Sue, she's been there for 30 years. She's been with that practice. So that was a big thing. It's like, how do we successfully implement, you know, me as the new owner? Obviously, I was very young at the time. How do I gain their trust and know that I'm there for the best intentions? And my intentions were over. I didn't want to be disruptive. I didn't want to change the culture of the practice, which MB2 is huge on that as well. So MB2 with that, they want to go in and they don't want to disrupt the culture.
Mm-hmm.
So we went in, I introduced myself to the patients. These patients, a lot of them, Dr. Bell, the retiring doctor, had been their only dentist their whole life.
Yeah.
So there's a lot of pressure there. But the way that we did it, and with Dr. Bell staying on for a few years and then me transitioning in full time, that made a huge difference. To making sure that the practice not only, continues on, but thrives after he's gone and we keep his legacy going.
It's nice. It's nice that he's stuck around and helped to transition. I know that definitely helps ease the patients from, oh, this is my trusted practitioner and he's helping
Putting
me.
a stamp of approval.
That's right.
Yeah.
That's
and he was really mindful of that. It was important to him. He didn't just want to sell, to anybody and walk away.
Well, and I think where I would give the most credit from the lens that I had was your ability to go in and say, I'm not here to do anything. I'm here to learn.
Mm-hmm.
You see a lot of times where whether it's, somebody who's been in practice ownership for a while or even just business ownership is I know what I'm doing. I'm ready to come in. I'm going to make some moves.
Definitely.
And you went in through a very humbling lens of I'm here. What you're doing works clearly. Let me learn from you and then see what I can do to add to it. So I remember that first week being very impressed by your ability to sit back and go, okay, so tell me a little bit about what you do. Tell me about yourself. Tell me about what works and what doesn't here so that I can be a good partner to the practice versus trying to make the practice fit to what you would expect of it.
Oh, exactly. And one of the things too, so is you and Susan Huff that came down.
For the team meeting.
Which they used to call it the warm hug back in the day. But
Dr. McBride is the reason we do not call it that anymore.
That does not surprise me. But one of the things that Susan told the team, and you guys were so amazing at this, because like you said, they were respecting that this may be a bit scary or a change for the team, but they were she said, take care of Dr. Mohn. And I remember that so vividly. She came from a point of she's here, she has the best intentions, she's going to be a young owner, and she really does want to learn and continue on what you guys have built, because my team especially, they're such a huge part of the success of the practice. Yeah. So I think they did. They lifted me up, they supported me, they helped me grow, and it's been just a beautiful, beautiful thing.
That's something in any partnership that we do, whether it's, in a transition from an outside doctor into an ownership role or just partnering with new dentists. One of the things that I hear a ton, right, is I'm scared for my staff. When that question becomes the first question that's asked, I know that we are talking with the right people. Mm-hmm. And then it becomes this conversation of, you've got to realize we have the same concerns with the staff and we understand the importance. And we want nothing more than to make them feel comfortable, be happy, and excited.
Yeah.
So that's cool.
Yeah.
You mentioned something earlier I want to go back to. You said Dr. McBride and Dr. Ann helped to prepare you for an ownership role, or you learned a lot of things. What are some of the things that you learned from them that assisted or aided you in now managing all these people in this practice?
Yeah, so it was across the board. So of course we want to make sure that before you have your own practice that you're clinically proficient.
Yeah.
And my goal was I wanted to be the most excellent general dentist that I could possibly be, meaning that when patients come to me and they need treatment, I want to be able to provide that for them and to do it in a way that's, the best of the best. And so I learned a lot from Dr. Ann in that regard. She was excellent at extractions, and that was something that I wanted to become more proficient in. So
I love that clinical mentorship.
It's amazing,
Yeah.
yes. So that was a huge role. And then with Dr. McBride, he was managing multiple practices. And for him, just seeing how he was able to manage associates, which, cut to today, we ended up bringing on an associate with my practice. And so I kind of took on being the mentee to now I'm the mentor. And they both were just so instrumental in giving me that support to wanting to step into the ownership role. And I really do feel that if I hadn't have had that mentorship, and learning from people who've been there, I really feel like if you follow the footsteps of successful people and they've made some mistakes, if you can learn from them without you having to make those mistakes, that's the way to go. So I'm forever grateful to them. And just fun fact, Dr. McBride is actually on our wedding certificate for my husband and I. He's a witness.
Okay.
He and Dr. Ann came to the
so
courthouse
cute.
to watch us get married because I wouldn't have met my husband if I hadn't moved to Midland.
That's awesome.
And I also wouldn't have my little girl if I hadn't have, moved there. So
Okay, whoa.
they're a big part of our story.
Big thing that I wanted to ask about, and sorry, JT,
No, you're
but
great.
when you and I first worked together, you were 2 days engaged, and now here we are, and you're a mom.
I'm a
So
mom.
how has your relationship as a dentist owner transitioned as you've stepped into a new role at home?
Yeah, exactly. So that's a tricky thing. I think you don't realize how much time can be taken away from a practice until you become a mom. You're working when you're at work, and then when you come home, you're still working.
Right.
And it's by far the most fulfilling role I've ever had in my life. It's something I'm so happy that I've been blessed enough to have her. But I think having MB2 there so that I can actually step away from the practice and not be spending my nights and weekends worrying about, this or that, or having to do payroll or those sort of things administratively, it frees me up and it gives me peace of mind that when I'm at home, I can be present with her.
Yeah.
And things go so fast. They progress so quickly. Like we were at the airport yesterday and she was just running down the
How old is she now?
16 months.
Holy
So
cow.
that's what I mean. It goes so fast. And so I don't want to miss any of those moments because they're so fleeting. And, she's a sponge. She's learning everything. So for me, like being able to not only have a successful, thriving practice, but also to be present as a mom, I really think if I didn't have ME2 on my side that I'd have to sacrifice something. But here I don't have to. I can, still be working, and I'm so passionate about dentistry, but also now explore my passion as a mom, and it's amazing.
That's so cool. So I've got 3 boys, and my oldest is 12 and my youngest is 6. And you talk about juggling all of the things, and it, as your little girl gets older, you're going to start to see, okay, now you've got dance practice, or you've got this, you got a school event, and you're running around like a chicken with its head cut off. And your point about the time is so short, everybody hears it, right? The days are long, but the years are short, and you don't understand that. And then my wife, you don't understand it, so you have kids. And then my wife the other day goes, hey, you realize when my youngest, my 6-year-old, is the age of my oldest. My oldest will be 18, and I was like, "Shut your mouth!" Like and
Say those words to me?
No, and I'm not an emotional guy. Not before I had kids, but I was.
It makes you emotional.
Oh my gosh!
Yeah.
I was.
Oh, I'm screwed.
I was talking with Lindsay the other day because she had sent a message about how she's just gotten super emotional with her little girl. I'm like, I used to cry at commercials after I had kids.
So true.
But
yeah, it really is.
It is the most fulfilling thing ever.
Absolutely. I feel like the luckiest person on the planet. And I think it's great too. I'm just so grateful to MB2 that they've been a part of my story.
Yeah.
So tell us about the office itself. You transition, right? What we see right now a lot, and get a lot of questions from prospective partners. Hey, what does this look like? Sarah has a team, and we continue to pour resources into that team to continue to do that successfully. But post-transition, you're now an operating owner.
Yes.
Tell us about the practice itself. Did it take a while to get ramped up? Did you see a dip? Like what what was that experience like?
Yeah. So one of the things you'd mentioned was, potential partners that are going to partner up, they're worried about their team, right?
Mm-hmm.
Well, coming in, they alleviated some of the roles. Like MB2 Central Headquarters was able to take on some of the roles that staff previously had to do, and make some seamless transitions there. But the staff was given more benefits, and that was really important to let them know, hey, we're here to take care of you too. So they were given, retirement benefits and then, health insurance. So with MB2 size, we're able to bring that in. But also too, the practice, we actually ended up growing quite a bit. So not only did we keep, everything consistent, but because the practice had previously been a one doc office, when I came in, we built out 2 more operatories. So MB2, with all their resources and their amazing team, were able to put in 2 more chairs so that I could come in and start practicing. So that immediately, boosted the practice. And then also, too, we had implemented some new marketing strategies. So they helped me, update the website. We had done radio ads at the time, and that was something that was important to the previous doctor. We kept those going and kind of refreshed things. Yes.
Mm-hmm.
The Dave Ramsey show. So
Love
that was
it.
a big, yeah. Mm-hmm.
I remember.
You remember,
Mhm.
yes. And then there were some other strategies too, like looking at supplies, procurement, that sort of thing. Like Dentira is something that we've implemented that really makes it easy for ordering. And then all the lab partnerships we had, I still use a local lab, but there were certain labs that, night guards, for example, or things that I wanted to really take advantage of, like our partnerships with other labs to do that, to kind of reduce overhead. So it's a combination of not only ramping up revenue and profitability in the practice, but also decreasing overhead. So we did grow significantly. And then when Dr. Bell, the retiring doctor, retired, we had brought in an associate now, Dr. LaFrance, who's been with me for probably going on 3.5 years. So yeah, so we've really expanded a lot.
I always find the dynamic interesting when a previous practice owner is now an associate. So like not only having a new doctor owner come in, but also with the partnership of MB2, did you feel like you had any sort of pushback or hesitation from the previous owner that's like, oh, but why are we changing that? We do it like this, even
That's a
though
great question.
practice level equity was no longer with him.
Yeah, exactly. So I think the way that we do it is we explained things that, like, we're not here, we're clinically, nothing's going to change at all. It's just that we're going to implement some systems on the back end that's going to support me now as the new owner. There are going to be things that he was accustomed to doing that now I get to delegate out. And so that's not only beneficial to me because that's what I was looking for as a dentist. I don't want to be spending my free time doing things, like that I know can be better done within a partnership organization. So I think he was understanding of that, the way that we explained how the integration would work. So, the bank account, that was the biggest thing. That's something that merges. But outside of that and, some software updates, things of those nature, nothing really changed in regards to the supplies we were using, type of dentistry we were doing, the fees, we're still fee for service, the hours, Monday through Thursday, 8 to 5, all of those things stayed the same.
The annual cruises.
Annual cruises
Oh, that's
definitely
awesome.
stayed the same. Yeah, we went to Costa Rica last year. So there's a picture of me and one of my assistants with a monkey on our head.
Oh,
So
cool.
it was a lot of fun. That's so big on the culture. Like, an organization could come in and just say, hey, cut that, that's expensive. But it's like, no, that's such a big part of our culture. We spend so much time together. We're a work family. And so we want to be able to celebrate and have a good time together and travel. So we're actually going to New York City here in October.
Oh, that'll be fun.
Yeah.
Did you feel like you had any pushback? I think this is kind of pushing a little bit further into Sarah's question, but from the prior owner, like decisions that you did make, did you ever feel like he was looking over your shoulder saying, oh, I wouldn't do that? Or, Dr. Mohn, that's not a good idea.
Mm-hmm.
Or did you have any of that?
I think there were some moments where it was like learning lessons for me I think I had to come in with some humility and not have an ego and not say like, I know everything, because there are going to be some ideas that I can implement that are fresh. You know, I'm a little bit of a younger generation, so I want to integrate technology systems like AI, that sort of thing. And that's one of the things that helps us stand out as a practice in my area. But fortunately, the previous owner had been keeping up with that, doing continuing education. He had like same day crowns. So he was already kind of up on technology. I think that if I would have been with a doctor who didn't want to, update or
Like have
upgrade,
paper charts or something.
there probably would have been pushback. Why are you using that, newfangled thing or something? But so I think I didn't get much pushback there. I think I learned a lot in regards to like treatment plan presenting to patients. He had a really unique way of doing that. And so they did give me feedback of, hey, this is, you're in a cosmetic fee-for-service practice now. It's a little bit different than an insurance run. There's more elective procedures. So initially, there was a bit of a transition for me to go from, okay, this isn't an insurance-based practice now. This is a practice where, I have a different type of patient base, and I need to be able to educate them and, give them the treatment that they're looking for, whether it be veneers or something more elective.
I love that.
Yeah. So he came in and he taught me methods to do that. So the feedback for me was actually really helpful. And I think that's what helped us thrive too.
That's great.
Yeah.
I think the last thing I wanted to ask, sorry, I know we've been going for a little while, is how you're liking the shift now from, like you mentioned, mentee to mentor. So we've talked a lot about like how you've been mentored, but how are you enjoying the mentoring that you get to do?
I love it. It's so great. It's really fulfilling.
Well, maybe Dr. LaFrance will be on here one day going, yeah, I am everything I am because of Dr. Mohn.
I know.
I
Just signed my birth certificate.
When I'm old and gray, signed her birth certificate.
Oh, yeah. No, you don't need that.
I think that's what's so cool is when you realize what an impact mentorship played in your life, in your career, and then you're like, okay, I learned this from my mentors, but now this is what I've learned through my experience. And now, it's been 9 years going on of practice ownership. There are things that I've learned that I can also teach and share, and she doesn't have to learn the hard way by going through it herself. It's been amazing. And the biggest thing too is like our patients appreciate the fact that she and I both are on the same page and have the same goals for our practice and them. And there's consistency. So either way, they're going to be really well taken care of.
Man, that's awesome. It's definitely a full circle moment, right? Hey, if you come in as an associate and you are humble and you are willing to be a sponge, then you end up as an owner at some point, and now you've got the opportunity with an associate to come in to be a sponge.
Exactly.
And that's really, really cool.
And that's what I think dentistry needs. I think we need that collaboration. It shouldn't be competitive, and it shouldn't be people just do the right thing. And at the end of the day, everything's going to work out.
Yeah.
Well, congratulations. You've had a lot happen in a decade. It's so cool to watch. And we appreciate you coming out here and doing this. Is there anything you wanted to talk about that we missed?
I don't think so. I'm just so grateful, to be here and to have MB2 grow along with me. And now, having a family and everything. And I think moving to Midland was definitely the best decision I've ever made. So. Cheers to that.
Cheers to that. Cheers to that. Well, Dr. Mohn, thanks for coming on. MB2 Undergrounders, we have reached the conclusion of our latest episode. So keep tuning in. We look forward to speaking and seeing you guys next time.
Out.